let's say first and foremost is our trial update session, where we'll be going over some of the most important data that we've had over the past year in cardiothoracic surgery. We'll be looking at the ischemia trial, how it applies to CABG, and especially some of the issues and data discrepancy that we've had between the different ischemia papers, going into a bit of detail there. Also some insights from the FAME3 trial investigators. And Joe Bavaria will be giving us a TBT registry data update. And as they accumulate more low-risk TAVR patients, this should lead to some interesting data regarding real-world results in low-risk patients. And of course, we're also looking at treating less and less symptomatic patients, and we'll have an overview of the trials in this space. The other very exciting session, or actually sessions, is the late-breaking trials. We always have a tremendous amount of submissions.
We have a cardiac technical college and a thoracic surgery technical college. We always bring the latest technology and techniques. Everything which has got to do with robotics is rather new, particularly in Europe, and we are dedicating some sessions to this. Also, we do not forget about the percutaneous techniques, not only for the management of aortic valve disease, but also for mitral valve disease and tricuspid valve disease. Don't forget the thoracic surgery. Again, plenty of robotic approaches happening there as well.
We'll have several discussions of first in man descriptions of new devices. For example, in our late-breaking trials, we'll have the Ileana coronary anastomosis device, which that will be the first description of. And in the technical college, of course, we'll have lots of devices and innovations. Also, a highlight session is the Dragon's Den, where we'll be looking at the most innovative devices and have them come head to head, have them pitched to our panel, which will include some venture capitalists. And so here we're really looking into how to promote innovation within cardiothoracic surgery, and how to help these get from the idea to an actual product.
In that respect, we have a rather close collaboration with some of the US associations, particularly the STS, and we try to work in Latin American, for instance, to do joint conferences over there. I think we have a voice in what surgeons think and feel. And there are many other aspects, not only education and training, but advocacy and the guidelines, for instance, how we look at the evidence and how we propose our recommendations for the treatment of different diseases, both of the heart and the lungs.
In terms of regulations, as you were asking your question, in Europe, we do have a major issue with the medical device regulations that have changed. And so that's put just our daily practice into question, that robotic cardiac surgery does not exist anymore if the devices are not being reassessed, recertified.
The meeting will be an in-person meeting only. So sessions will not be streamed live. But we have a new feature this year, which is a TV studio, EACTS TV. Now that will be running during the course of the day here in Europe, and it will be broadcasted from the exhibition of the annual meeting. And there will be a mix of things like, we'll have interviews, prominent surgeons, we'll have summaries of the most important sessions. We'll discuss the evidence which may have been shown in the sessions, and those which we think are the most important, we will connect with them live to a stream, but just a small portions of those. But it'll be quite exciting because you will get the very best of the annual meeting by looking at that.
And the idea is really to provide an extract of the meeting that for people who can't come, obviously those who register to the meeting and come will also have access to to all the recorded sessions and be able to see that in our media library. But for those who can't come, this will be a new feature that's being completely developed, where we choose different sessions to stream and then have discussions with experts to review what was discussed during the session and to get a bit wider discussion.
Thanks.
Okay, John. Thank you so much.
Thanks, John.
Take care. Bye-bye.
Bye-bye.